It's time to refresh your yard during spring backyard days at the Home Depot. Get low prices guaranteed on propane grills starting at $179, like the Next Grill 3-burner gas grill. Or get $50 off a select Weber Spirit grill and bring big flavor to your backyard. Then set the scene with Hampton Bay string lights that bring it all together. Shop spring backyard days for 7 days at the Home Depot, now through May 6th. Exclusions apply. See homedepot.com/price match for details.
Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Welcome to the Dr. Raj Podcast. Today's episode features Everyday Rheum, a guest series hosted by Dr. Michelle Koolaee. She is a board-certified rheumatologist with a direct care practice in Pasadena, California. She trained at the University of Pennsylvania and serves as faculty and educator at Huntington Hospital, an affiliate of Cedars-Sinai. Inspired by the conversations she has with her clients every day, this series brings practical insights in rheumatology to patients and the medical community alike. And now, here's today's episode.
Hi, and welcome to Everyday Rheum. This is a guest series on the Dr. Raj podcast. This podcast is inspired by the real conversations I have with patients and colleagues every day. Our goal is to bring you knowledge, support, and encouragement to help you manage your rheumatology needs with confidence. Now, if you've been told you might need a knee, hip, or shoulder replacement, but you're not ready for surgery, this episode is for you. Today, we're talking about progressive, non-surgical options that aim to reduce pain and improve function. I'm thrilled to be joined by Dr. Jonathan Gelber, an experienced board-certified orthopedic surgeon with advanced training in sports medicine and arthroscopic surgery. He has a private practice in Toluca Lake, California, where he also focuses on integrative and biologic approaches to joint care. Thank you so much, Dr. Gelber, for being here today.
Yeah, thanks for having me.
Of course. So let's dive right into it. So, Dr. Gelber, can you tell us a little bit about your background and what led you to focus on non-surgical and orthopedic biologics?
So yeah, as we mentioned, my background is as an orthopedic surgeon. So I've trained in arthroscopic surgery, joint replacement, fracture care, but my specialization was sports medicine, arthroscopic surgery. So with arthroscopic surgery, we focus a lot on repairing torn rotator cuffs, ACL reconstruction, meniscus tears, and things of that nature. So as we start to see people progress after having arthroscopic surgery, a lot of patients develop arthritis. And once we get in there with the camera, you can actually see that the arthritis is a biological process. It's a disease progression. So much like diabetes, where there is an early stage, a middle stage, and a late stage, the same thing can be true of arthritis. And we used to think of arthritis as just a degenerative joint disease. It was just wear and tear. But in fact, we understand more about it as a biological inflammation process. So it's actually something that we can treat early on that hopefully can delay or even prevent joint replacement.
So for someone that's hearing this for the first time, what exactly are orthopedic biologics?
So there are different things that we can do to try and restore your body's capabilities to reduce inflammation and promote healing of arthritic conditions. So one example is PRP, or platelet-rich plasma. So you might have heard of cortisone, which is an anti-inflammatory injection, and that's useful in the short term. But in fact, cortisone can cause worsening of arthritis. Surgeries, for example, like removing part of your meniscus that's torn, may also give you short-term relief, but also can progress to arthritis because we're taking away cushion. So what PRP is an attempt to get your own body's cells to try and heal things and even slow the progression of arthritis. So PRP stands for platelet-rich plasma. And so what that means is we draw blood from your arm, which we do in the office. We spin in a centrifuge. And by spinning in a centrifuge, you can separate out the platelets in the plasma from the rest of the blood. And the platelets have these little healing and signaling factors in them. So when you inject them into an area, they help to reduce inflammation, they promote healing, but they also call other cells to that area, other cells that help with cartilage and bone health. And so by bringing these other cells into the area, you can further help with the regeneration or strengthening of cartilage. In fact, if you look at people who've had PRP, their joint replacement rates go down, the cartilage thickness also goes up. So we're trying to use your own body's cells, its own body's signaling pathways to heal the arthritic joint.
We're really talking about, and to emphasize for people that are listening, this is really about healing versus masking pain.
Correct. So this is a long-term treatment. So it's not a quick fix. So with cortisone or Toradol, which is a non-steroid anti-inflammatory, which we also do, you can get several weeks, maybe even several months of pain relief. Sometimes it's only as a few days. But it's not doing anything to change the biological process that's happening inside the joint. So PRP can take up to 6 weeks to start working because it's a signaling process. So those platelets are telling other cells to come to the area. Those cells are then doing things to help the cartilage and the tendons and the joints. And so that whole process can take several weeks to start unfolding. And you might not see the full improvement for maybe even 3 months, but the benefit can last over a year.
And so just speaking off and discussing PRP, how often, Dr. Gelber, do you recommend in general your patients receive PRP injections?
So that's something that's been evolving over the last few years. So we used to look at how many injections of PRP someone might need. Was it 1 injection, 2 injections, 3 injections? Do we do them weekly? Do we do them every 6 weeks? But the research now actually shows that a lot of what is important is the total number of platelets that we're delivering. Just like ibuprofen or other medications, you might have 200 milligrams, 400 milligrams, 800 milligrams. So the higher the ibuprofen dose, the more effective it is. Well, the same thing's true with PRP. So the more blood that we draw, the more platelets that we get. So some places only draw a little bit of blood and they're only getting a little bit of platelets, so the effects may not last very long, if at all. When we draw more blood, we get more platelets. So we're giving a higher dose. So this is called high dose PRP. And so if we do that, what the research is showing us is that we might only need to do that once a year or once every 18 months. So we're doing all those injections at once because we're delivering all the platelets at once.
I see. Do you do high dose PRP in your practice?
Yep, we always draw a high dose. So that might be 60 cc's for a tendon problem or 120 cc's of blood for the arthritis because we're trying to hit a target number of at least 8 billion platelets. So we know based on the average person's platelet count that if we draw a certain amount of blood, in this case 120 cc's of blood, that we're going to hit that target number of the minimum of 8 billion platelets, which is what we need for the best effect.
I see. So let's say there's a patient and I have someone in mind. She has moderate to severe knee osteoarthritis and she really, really wants to avoid knee replacement. What would a typical treatment plan look like for her?
So we want to have someone come in and look at x-rays first because x-rays are going to give us an idea of how much joint space is remaining. And oftentimes we have to get our own x-rays because we want to get weight-bearing x-rays. We also want to see what your knee looks like when we start to bend the knee. So that can also change the space between the bones. And if you have an MRI, that's great. We don't always necessarily need an MRI for dealing with arthritis, because what really matters is what happens when you're standing up. So we get those views when you're standing, when you're putting weight on your knees, we're going to see how much space is between the bones. Based on that, we can get a level of the arthritis. Is it early, is it moderate, or is it severe bone on bone? And then from there, we can talk about the various options. As I mentioned before, there are the short-term solutions like cortisone or Toradol, or the long-term solutions like PRP. And in addition to that, we have an infrared laser. So an infrared laser works using certain wavelengths of light to reduce pain and inflammation, but also promotes blood flow, and it also activates the platelets. It can activate the mitochondria or the powerhouses of cells. So we often combine the infrared laser with the PRP. And so we do 1 or 2 sessions of laser before the injection, an injection the day of, or laser rather the day of the injection, and then 2 or 3 after. So we're able to continually amplify the effects of the PRP. So it's not just a one-day thing, a one-and-done thing. We're actually doing all we can to promote the PRP to be as effective as possible.
So it's the combination of infrared, laser, and the PRP. Is that a common combination that you use?
Yeah, we use them all in our packages. So that's how we try and do it because we want to optimize what you're doing. We also try to do things to increase your platelets. So papaya extract, for example, has been shown to help increase platelets. Doing 20 minutes of moderate exercise before the injection is good. Trying to eat an anti-inflammatory diet in the days or weeks leading up to it, because you have to remember that you're the pharmacy. So whatever we're drawing, we're putting back in. So that blood, that medicine is coming from you. So the healthier you are and the more powerful and higher number of platelets that you can give us, the better the injection.
I see. So in that same patient, how do you counsel patients in terms of when would they start to expect to see results? What type of results? Can you talk about that?
hmm So it can take up to 6 weeks to start working. So you may not
Hmm.
notice the effects right away, but typically by 6 weeks, you'll start to notice some improvement. And that
Hmm.
improvement will gradually improve over the next 6 weeks. So maybe around 3 to 4 months, you're starting to see some really high level improvement. That can improve even up to 6 months after the injection. And then the effects of the injection can last 12 to 18 months.
So you mentioned some of the other therapies, exosomes, hyperbaric oxygen, other peptides. Can you touch on these? And what are the differences? And when would you decide which patient gets those other treatments?
hmm So, as I mentioned, and you mentioned, we're an integrative and wellness practice. So, we focus on treating the whole patient. So, we take a holistic approach. So, some examples of that include the hyperbaric oxygen chamber that we have. So, hyperbaric oxygen chambers are a treatment where you breathe in oxygen, a highly concentrated form of oxygen, and then we increase the pressure around you so that the cabin pressure, like in an airplane, changes when you go up or down. So, this is like as you're descending, the cabin pressure increases. So when the pressure around you increases, it drives more oxygen into the cells, and that oxygen goes to the rest of the body. So we use the hyperbaric chamber for overall wellness. There are people that use it after surgery. It can also increase the number of circulating stem cells if you want to use that to prepare for the PRP. So there's a lot of benefit to using that. Another area that we've been exploring are peptides. So many people may have heard of peptides on social media, or they might know someone who's using peptides. So what peptides are, they're these small little amino acids. They're not quite big enough to be called a protein. And they have certain effects in the body. And many of them are found naturally occurring in your own body. So for example, insulin is a very old peptide used since the 1970s. The GLP-1s like Ozempic are peptides. So many of them are injectable. A few are available orally. And what they do is they help to promote restoring the body's natural balance, whether that's modulating your immune system to reduce inflammation or promoting healing. So a lot of people come to see us after an injury because they're interested in certain peptides like BPC 157. Helps with injuries. It helps with the fibroblasts or the cells that produce collagen. It also increases blood flow to the area because, again, as we mentioned with the infrared laser as well as PRP, getting blood flow to areas is important because that's how things can heal. And there's some other ones too. There are like growth hormone releasing peptides. So as we get older, we don't release as much growth hormone. We make it, we're just not releasing it. So there are peptides that you can take that can mimic the increases or spikes of growth hormone that occur naturally in your body. And this also can help with sleep as well as injury recovery.
And then what are exosomes?
So exosomes are another strong area of medicine. So when stem cells talk to each other, they do so through these little packets of DNA called exosomes. So they send these packets of DNA from the stem cell to the other cells to tell them what to do, similar to what PRP does. It just doesn't use the DNA to do that. And so these exosomes don't come from you, so they can be a bit more expensive than the PRP. But what they do is when they grow them in the labs, they're also growing them in sort of a broth of growth factors and healing factors. So when you inject exosomes, you're also injecting healing factors as well. So it's not just the exosomes or the DNA themselves, but this is about the closest thing that we can get to stem cells right now in the US. You can get stem cells from your own body, and that's another method that we can use. So you can get stem cells from your bone marrow. So you can get bone marrow stem cells from your hip. You can also get it from the fat tissue around your abdomen. So there's abdominal fat that you can do like a mini liposuction and take some stem cells and fat and inject that into joints as well. So we do have some other options around stem cells, but true stem cells, like people are thinking of that they might have heard in science fiction movies, they're not being done here in the US, at least not well. So the closest thing to that is using PRP, using your own stem cells, or using exosomes.
I see. Thank you. So are you finding, Dr. Gelber, that when people come to your practice, have they done their own research and of these different orthobiologics? Do they know what they want, or is it that they're really just coming in with an open mind and really leaning on you to provide that that holistic approach to help them understand what could be options for them?
Yeah, it's definitely a mixed picture. Some people come in because they have been told they need a knee replacement or a hip replacement or a shoulder replacement, and they've researched alternatives. And then Google or ChatGPT send them our way, and then we talk about those options. The other half are the patients that are referred through insurance. or by their primary care providers because they think they need a knee replacement or they have knee pain, and we get x-rays and it shows they have bone-on-bone arthritis. And so that's when we talk about all the various options, and we go over the cortisone, the Toradol. Some insurances will cover viscosupplementation or gel injections, which can help lubricate joints. And then, of course, we have the regenerative medicine options like the PRP. So I like to lay it out for everybody, and then just based on what your goals are, whether you're ready to go through insurance or pay out of pocket, if you're looking for a short-term solution versus a long-term solution. So these are all, different answers. And there's not one right answer. It really depends on where you are in your patient journey.
I see. So as a rheumatologist, I also see a lot of arthritis, as we know here. And one of the most difficult types of arthritis is erosive osteoarthritis in the hands. And that, we've looked at least in the rheumatology literature, just a lot of our immune drugs are not effective, and can be very disruptive. Any approaches, and what are your thoughts in terms of if someone comes to you with really disruptive, painful osteoarthritis of the hand?
Mm-hmm. So with all of arthritis, we want to treat the inflammation. And so inflammation can come from several sources. Some of it is the joint itself. Some of it can be environmental. Some of it can be hormone imbalances, vitamin D deficiency, microbiome changes in the gut. In fact, there are some really interesting studies looking at the connection between the microbiome of the gut and arthritis. So we can, reduce inflammation. We can make pain go away. So we'll sometimes have people come in. You can ask any orthopedic surgeon, and they've seen this. A patient will come in with bone-on-bone arthritis in one knee, and it's the other knee that hurts. Why? Because the other knee has inflammation, even though it doesn't have as much arthritis. So if we can reduce inflammation, then yes, we can certainly improve your pain. Beyond that, you can do the injections. If you're dealing with multiple joints, though, I do like the laser, because the laser you can use over a wide area. The laser, you want to do about 12 sessions, so typically twice a week for 6 weeks or 3 times a week for a month to kind of knock those sessions out. But when you're doing a large surface area, you can really hit it with the laser. Otherwise, if you want to do something more locally, more focal, that's where the injections come in. So, there are different approaches. There's a systemic approach, treating the underlying hormone imbalances or vitamin D deficiency. There's the sort of broad area by using the laser, or there's the focal injections like PRP.
Yeah, I really like what you're sharing as far as, a lot of people that I see with hand osteoarthritis, it's multiple joints in the hands. And so I'm interested in, and I think it's really exciting, the infrared laser that you're talking about. And so is it the same timeline in terms of waiting the 6 weeks to see improvement?
Not necessarily. I mean, the longer something's been around, the more sessions it takes to see improvement. Mm-hmm. But sometimes we'll see improvement. I mean, I've had people see improvement after one session.
I see.
I would say average is probably 3 to 4 to start seeing some improvements. Good rule of thumb maybe is 10% better each session. So by maybe 5 sessions, you're 50% better. Mm-hmm. But really, the more sessions you do, the longer the lasting effects. And that's why we shoot for 12, because 1 or 2 just don't work. They might feel good briefly, but it's cumulative. So the more you do, the better you feel and the longer it lasts.
And then those individuals, once they're really happy with their results, would it be reasonable to come back periodically for maintenance?
Yeah, you can do short maintenance ones, maybe once every 2 months, once every 3 months. Yeah, you can definitely do maintenance sessions once the pain goes away.
I see.
It takes more in those initial phases to make the pain go away. So, it's like working out. People, they feel like, it's easier to maintain than it is harder to build. I think the same thing's true probably with the laser.
Absolutely. So tell us about your 3-month non-operative joint recovery and longevity program. Who's the right candidate for that?
Mm-hmm. So this is someone who really wants to take a deep dive into the underlying sources of inflammation and arthritis. So it combines pretty much everything we just talked about. So it uses hyperbaric oxygen in the initial stages to increase your stem cells. It uses infrared laser before, during, and after PRP treatment. In addition, we also use something called A2M. So when you separate the plasma, you can have the platelet-rich plasma, which is the one with all the platelets that most people are injecting. But then there's a whole bunch of plasma that doesn't have the platelets. That's called platelet-poor plasma. But there's actually other anti-inflammatory proteins in that platelet-poor plasma. One of them is called A2M, which is a strong anti-inflammatory that can prevent the progression of arthritis. So we can also add in the A2M by treating that plasma that doesn't have the platelets and adding that to the PRP. And then on top of that, we're going to do a deep dive into hormone imbalances, nutritional deficiencies, and as I mentioned, the microbiome of your gut or your intestinal health, because that can also be an underlying source of the inflammation, possibly your arthritis.
Okay. No, that's really exciting. And it's, I think people, this is really an excellent resource. As I see, there's a lot of people just in my practice that are really open to other strategies other than surgery to help manage their arthritic symptoms. So this is really, really enlightening. If someone's trying to decide whether to explore these options, Dr. Gelber, what's the first step?
I mean, a consultation is always the first step so that we can sit and talk, and an examination is always important, and we want to get x-rays, but we also want to treat you, the patient. So, x-rays tell us one thing, but, seeing you, talking to you, getting to know you is an entirely important part of the experience. So in a consultation is where we can go through all these things. And, if you're using insurance, we can do consultations through insurance. We can also do things like cortisone and Toradol and sometimes a viscosupplementation through insurance. But unfortunately, at this stage, all the deep dive, root cause labs, the PRP, all those things that are somewhere between cortisone and joint replacement are not covered by insurance. But of course, we can cross that bridge if we need to.
Excellent. Thank you. So this episode, it's about giving you options for those that are listening, especially if you're not ready for surgery. The goal is to help you make informed decisions about your body. Thank you so much, Dr. Gelber, for being here today, for sharing about your practice, about what you do, and how you can support many individuals with arthritis that are looking to avoid surgery.
Thank you.
Thank you for listening to another episode of the Dr. Raj Podcast. If you enjoy the show, then please make sure to follow us on your favorite podcast app and leave a rating while you're there. This show is for educational and entertainment purposes only and is not intended as medical advice. This has been a production of MedPrep to Go, and you can learn more at medprep2go.com.
The right window treatments change everything: your sleep, your privacy, the way every room looks and feels. At Blinds.com, we've spent 30 years making it surprisingly simple to get exactly what your home needs. We've covered over 25 million windows and have 50,000 five-star reviews to prove we deliver. Whether you DIY it or want a pro to handle everything from measure to install, we have you covered. Real design professionals, free samples, zero pressure. Right now, get up to 50% off with minimum purchase, plus get a free professional measure at Blinds.com. Rules and restrictions apply.